With that, we are going to transition right on into, and this conversation flows very well into this next discussion. So again, we shared this with everyone. This is an optional additional 30 minutes or however long you can stay to share some more thoughts. So I'm going to turn it over to Libby to go ahead and just get us started here. Libby?
Thanks, Brittany. So we wanted to have a conversation about this request for information. A request from information from CMS is an open forum to submit opinions, thoughts on a given topic. In this case, it's a very broad topic of healthcare technology, technology in healthcare. And when you go into the request for information, there's a large I would say after reading through all of it, and I would not, say that you have to read through all of it in order to submit an opinion. But after reading through all of it, they really are inviting comment from patients and family caregivers. And so I would encourage each of you to submit your own comments if you so choose. But we also wanted to have a conversation with our PFA network community to see how do we move forward as a unified voice and what messages do we need to submit in response to this RFI. So I know I don't know anything. I will say my experience when I first started looking at requests for informations or RFIs, it seemed really formal. It seemed really daunting. It seemed really overwhelming. And this one isn't really any different. It is a little bit overwhelming. But that is not to say that our plain language words and our plain language ideas are not necessary as part of this process. So as CMS develops its and supports development of healthcare technology, we want to have our voice in there. I mean, I think what Jean was saying earlier was so illuminating of the need for every stakeholder to be represented as these programs get developed. And so this is our chance. And it doesn't have to be overwhelming. It doesn't have to be sophisticated. So yeah, wanted to kind of level set that idea. I assure you that what I submit for PFA network members will be very plain language, will be very first person, not first person, but personal in nature. So, all right. So yeah, thank you. The RFI then is to explore digital products, so digital health support products. So I think some of the definitions used for the RFI are really important. Digital tools, and this CMS strategy is very heavy on empowering patients to better their health through the use of a lot of technology. So that's kind of a little bit more background. So digital health products then are defined as digital tools that support individual health needs. So those for each of us. Health management applications are tools that leverage patients' data and information to support patients with healthcare decision making. Care navigation applications, more geared towards access, and then personal health record apps. So just in keeping those kinds of ideas or those kinds of definitions in mind, then we had a few questions. So on the next slide, Brett, I think, or are we going to go to polls now?
Yep. So I will pull up one poll at a time, but also here to be able to read through the questions. Yep. So let me go to poll number.
So these were some questions from that are on the RFI, just kind of bucketing. I have to say, I'm sorry, I'm really running through this, but I have to say there are, I think, 15 questions for patients and families in the RFI. So if you do go in there, don't worry that you have to answer every single one. And so these questions are kind of getting to some of the more overview responses that CMS was looking for. So the first question, and we're going to ask this in an open poll way so that we ensure we get everybody's responses, but we can also have a discussion about it as well. I would like to do that. So the first question is which elements of today's digital health ecosystems are working? So what's working in the world? What apps do you grab to help you with your healthcare management? What portals? And I'll be quiet so you can answer.
And Beverly, specifically, I know you're still on. If you also feel free to come off of mute if you wanted to share anything. I know we have the poll and chat, but I know you said you're on your phone. So if you need to, if anyone needs to say anything verbally, definitely feel free.
Thank you. I'm thinking.
No problem. Thank you.
Excellent.
I think what's so hard, because I keep going back to living in a senior community, and I realize that there are some who don't even know how to use an app on a telephone, and they depend on other folks. So I, because I use it, I cannot assume that everybody else can or will. And then some of them are dropping their internet because internet is so expensive. So that's why I'm still thinking about, I know what works for me, but what would work for folks who do not have internet? What would work for folks who are still using a flip phone? What is working? I'm going to be quiet and wait.
Thanks, Beverly.
Thank you, Beverly. And Karen, I saw your hand go up. Karen Edwards, feel free to come off of mute.
Okay, this is really very interesting to me. And I was trying to find the link that they had sent me. However, I think this is something that needs to be addressed, especially when we talk about digital um, internet access as it relates to the elderly population, those individuals that have chronic disease and illness, people that lived in underserved areas, accessing the internet, and also knowing how to use technology. There are seniors and others that may have iPhones or whatever, but they may not know how to use them. I think in today's time, being digitally literate is critical. And I think it's very important. And that's one of the reasons why I would like to give my responses to that. And that relates to uh, um, a collaboration here in Detroit where I live. And it's called the Detroit Health Equity and Alliance. And one of the core areas that we're focusing on is digital health uh, and education for the elderly population. And we have devised or developed a booklet that is basic, that teaches the prompts and things of that sort. So myself today, I wasn't feeling well, and I called one of my friends, and she mentioned the patient portal. And unfortunately, I have I have a portal, but I do not access it. And earlier we mentioned the shared uh, access to the portal. I think that's an awesome idea because oftentimes I may not feel uh, like accessing it because I'm accustomed to getting the feedback one on one with the physician.
Thanks so much, Karen. That's really helpful. And I would encourage you to take the link for the RFI and I'll send it to you, or maybe we can pop it into the chat, to the organization that you mentioned that you're working with, because it would be so important for that voice to be heard in that response. Yeah. Bye, Isaac.
Thank you, Isaac.
Isaac needs to drop for another meeting, so hopefully we are not in need of Spanish, but we have put the questions in Spanish, so feel free to respond in the chat. All right.
Libby, are we good to go to?
Yeah, let's
In
go
this
ahead and
instance,
keep
we
moving
probably could have done that.
because this is going to go really quick.
Yep. Okay. So I am going to stop this particular poll. I see 3 of you shared. Can you all see anything? I clicked share results. Karen, you can. Thank you. I'm a host, so
I can't.
okay.
Thank
Nor
you.
can I. It just said Karen. So Karen Fernandez.
On now, but I could see it.
Okay. You're seeing responses.
I saw it momentarily, and it showed my response, and then it went away.
It might just share your own since it's personalized short answers. Okay, either way, I'm
Got it.
going to go to the next poll.
Thank you.
To keep things moving. So let me go close out my poll. Give me just, oh, here we go. All right, poll number 2.
So the next poll, as we're getting that pulled up, is what elements are working inconsistently and need improvement? So something, like the patient portals, by and large, they're working, but how could we improve those? So something, that it's like you use it, but it could be better. Anything? And feel free to respond either in the poll or come off mute and share your thought with us.
I think we answered that in our meeting before. We
Yeah.
need something where people can actually talk into the portal, ask questions. If we're using AI for everything else, why can't we have AI that says, tell me what my last test results were and how do they compare to the ones last year? And have AI come up with something. I mean, that's for people who know how to use it. But I think if we're going to have technology, the portals work, they just don't work for everybody.
I think that's a really important point that, came up on our last call as well. But the reciprocal nature of the portals is what we're kind of struggling with. And I think that, the way that these systems are using AI, it doesn't rely on the patient to necessarily know how to use AI because it's just seamless, like we won't even see it. I do think that that raises some transparency concerns for myself, but I think that's a really good point, Beverly, that, we could reduce the burden and have patients get the information they need in the way that they can receive it. Great idea.
Okay, well, I think we can go on to poll 3 since we did talk a lot about some of these similar things.
Okay.
The same amount of answers that came in last time as well. So, all right, I'm going to close this one, everyone.
Well, I can't wait to see them because I can't see them.
I know, and they don't pop when I click share results. They don't pop up for me.
That's okay.
So, okay. All right.
Technology, right? We just have to be brave and try.
Right. At least they're being captured.
Yeah.
All right. I'm going to go to poll 3.
Great.
It just showed for me, and I'm closing the poll.
Okay.
Oh, so
Thank you,
interesting.
Karen, did it show your response?
Yes.
Okay. All right. Helpful to know. Okay. Poll 3 that should have just popped up.
Yeah.
Did it pop up?
It did. Yes.
Okay. I thought you were saying something. Okay. Sorry.
No, I was just going to read the question. So what elements are not working or are impeding? So is there any bit of technology that's getting in the way or of your relationship with your providers? Anything that's not working?
I'm not sure it's about technology. One of the things that I have found is that my doctor uses a scribe, and I've gone back to read what was written and have found inconsistencies, but the doctor has signed off on it. And so when I go in to ask on the portal, that's when we end up in a conversation. And I say, do we need a virtual visit? So I'm not sure it's technology, but how do we ensure that what has been recorded is really what is recorded? Is that technology or is that humanity?
It's that I would say it's both, right? Because I just had that experience the other day when I went to for my survivorship appointment. And then I came back and looked at my portal. I'm like, well, that's not right. And um, my clinician was using an automated scribe program. So yeah, then how do we get that corrected? How do we, where is that pathway? I don't think that pathway is as clear. So I do think it's somewhat of a technology. I mean, it is a technology flaw, but you're right, it's also a human misstep for the physician or clinician to sign off on it. So I would say it's kind of both. But again,
This
if
is
we think about
Karen.
technology supporting the relationship, that's
Yeah.
that's not working.
This is an interesting discussion because I had a hospitalization recently. I never once saw the scribe, never once. Usually in early days, the scribe was with the doctor. The
Right.
scribe was never in my vision, yet the scribe did the notes. Well, how accurate did he really do those notes? I had a question.
So and we should clarify, my experience recently is that scribes are automated AI program listening as you're in the visit. I don't think it's any longer a person, but I don't know. But that's what I'm speaking of. There was no person in the room. It's these automated AI scribes. Is that what you were
Absolutely.
talking about?
No, no, did the AI scribe that you experienced, Libby, how did they identify the AI? Where my scribe, it was identified by an individual's name.
Well, I can say that my primary care asks at every visit, do you mind if I use an AI scribe? And I say
Really?
yes. And my clinician, I think he did ask me as well. But Beverly, was that your experience or were you talking about an individual?
No, I'm talking about when I go in to see my primary and
Hmm.
she says, do you mind if I have a scribe? Sometimes I have an AI scribe and sometimes she has a human scribe and she calls him by name.
Okay. Interesting.
I've
But
had
I've never seen the scribe. The person has never been in the room. The person is always on the computer.
Interesting.
How do they hear what the doctor's saying if they're not in the room and it's a person?
Through the computer, through the computer phone.
A computer phone, really? Okay.
Yeah.
Well, it would be similar, I suppose, if you had, I'm sure that's not the way they do it, but if you had an open Zoom meeting, they would be able to be part of that as well. So something
Yeah.
similar, I would imagine. Um, okay.
I'm going to launch the
Yeah,
last.
why don't we go ahead and go to the last poll? That would be great. And so how can Health and Human Services encourage patient and caregiver and provider use of digital health products? So I don't know how much time organizations spent trying to get patients to sign up for the portal. But how can we help people to access these tools to help them manage their healthcare? I mean, the thing that jumps out to me is like what Ray was talking about is the peer support as a mechanism to help people access. But Karen, did you have a thought?
My thought, I agree with the peer support, but also I think self-advocacy. And when you're going in, it is very important that the clinician or caregiver or social worker encourage the patient to sign up and let them know how it could benefit them. Because as a patient, if you do not know how it could benefit you, then it's null and void. For example, today I wasn't feeling good, and Anita, she says, "Well, check your patient portal." I couldn't check my patient portal because I had not registered. So because I was, old school and accustomed to the face to face.
Yep.
So now I'm learning the importance of the digital technology society that we currently live in. So I think education is really important.
I
Karen, do
want to
you? Oh, go ahead, Beverly.
No, I would say I want to agree with her. You know that time that you spend with a nurse practitioner when she's taking your weight and checking your blood pressure and looking at your temperature and all that kind, that would be a perfect time for them to say, in case you want to talk with your doctor, make sure that you register for the portal. Do you need more information about it? And while you're waiting for the doctor, they have something to read or something to see or something or a link to get to where they actually get the information, because that is when you will have my attention.
Mm-hmm.
And so I agree. I think it needs to come from the healthcare professional. And the other thing for seniors at the wellness, that that wellness evaluation that you have to do once a year because Medicare requires it, that is a perfect time while I am counting backwards from 100 minus 7. Also tell me about uh, the portal. Are you using a portal? This is what it's good for, and so forth. There are times when they could just kind of sneak that in as part
Yeah,
of what they do.
I love that. I do not look forward to that test because I couldn't do that today. Math is hard. But I wanted to follow up, and these are great points. I wanted to follow up. Karen, do you feel like the registration and the way that you have to get access to the portal initially, is that a barrier for a lot of people?
Which Karen?
Oh, I'm sorry, Karen Edwards.
Okay,
I
your
was trying to follow
question
up on
was,
your question.
say that again, please.
I was trying to follow up on your question, and I was just thinking you were talking about not signing up because you didn't necessarily see the value in it, and so having that value statement given to you. But I also wonder, I know some of the registration processes for the portal themselves are difficult. You have to have a number, you have to have a link, all of those things. Do you think that that initial registration process is a barrier?
I do. Anything that's very lengthy for it was for me when I was younger, but especially for me as an older adult with
Mm-hmm.
chronic illnesses. The initial process is very lengthy. So I think in the process of going to the primary care physician in that dialogue with a nurse or whomever, that is the perfect time when
Mm-hmm.
you assist them or have a navigator to assist the patient
Mm-hmm.
sign up for the patient portal. They
Makes
can
sense.
also make a follow-up phone call.
Mm-hmm.
But it's really, really important that the caregiver clinician tell the benefits of having access to that patient portal.
Mm-hmm. Thank you. I appreciate that. And Michelle, I'm also calling out your comments in the chat. I see those. I love that community events concept. Again, it's about people helping people get to access. Ray, what do you think?
Yes, through the Department of Aging and Disabilities, through LA County, I sit on the County Commission on Disabilities, which we work close together with Aging and Disability Department,
Mm-hmm.
and they utilize different technologies to help individuals. I shared a few of them on chat, but one of them is a iPad program for seniors to help them with individual simplified applications um, that they could use uh, for different variety of things. But there's something in there about health as well, to how to
Mm-hmm.
access their health portal. because I know cell phone devices are really, really small and compact, and also they're able to do it at no cost, so the individual could take it home. And I believe they have a program to provide free internet to different resources for individuals with low income.
Mm-hmm.
So there's a variety of tools that again, branches that lead out to people being able to access their health at no cost. It's just, I guess, county and dependent on the different senior centers and independent living centers that are out there that provide services. The challenge is discovering those nuggets uh,
Right.
of resources that are available in your area. So it's kind of the groundwork that, I mean, the outside resources and people who work in that um, arena could help you with. Unfortunately, inpatients and doctors and nurses, they're limited how far they could take you in that aspect of it. But yeah, hopefully that helps.
That does help, right? Because I think this is an opportunity for us to say, these programs work. They help people. They help people access and have what they need to be able to participate in these healthcare technology solutions. And that's an important thing for HHS and CMS at the federal level to know that funding for these local programs work and they're helpful. And that's part of how we get people to engage. So I think what you just shared is critically important. And yes, for all of us who are navigating our own local communities, going out and finding those nuggets is critically important. And then sharing those and raising awareness, that's critically important to our role. But for this RFI, I would then include, support for those local programs as well. All right. Well, as Brittany and I assumed.
I have one more comment.
Oh, yeah, go
I
ahead.
was I read something the other day, and I was looking up something on digital inclusion, and
Mhm.
it indicated that the federal government and the agencies like Health and Human Service and CDC, they're now seeing digital inclusion for aging population as a social determinant of health. And
Hmm.
I found that to be quite interesting.
That is interesting. I have not heard that term, and particularly related to the aging community, but it makes perfect sense. It's
Right. It's like basically things in society that impede one accessing quality and optimal health care.
hmm
That makes sense, Libby, because I have been working with people here for the Alzheimer's walk. And
hmm
I read in their report that there are 6.9 more million, 6.9 million more people with Alzheimer's than last year. What does that say for technology? How are these people going to get through technology?
It's a big, big question, Beverly. I think I saw the same report or something similar. And I guess, for a lot of folks in that population, they're going to rely on this concept of shared access. So I think that does also need to be part of our response.
Absolutely.
Libby,
hmm Yeah, Karen.
I was on the TEP committee for social determinants of health, and that was never discussed, but it's such an important element.
I know. And I agree. I really, I just feel like everything is accelerating so quickly in the technology field. And this administration is so focused on bringing technology into healthcare. And I think that can be a positive thing, but only if we're designing together and with all of the perspectives, represented. So that's kind of what we're convening today to move forward the PFA network voice. Ray.
Yeah, just briefly on the iPads they give out to older adults. They just don't only give it to you and hopefully you could figure it out. They they have to agree to complete a 8-week training course. And I think
Oh.
that's key because they provide that for you.
Mhm.
This way they don't give you a crash course and say good luck. Hopefully you could figure it out. They give you time to gradually learn something in order to be able to receive one of these iPads with the simplified apps that are on it so you could access key things of your lifestyle. So that's probably the key feature there is the training piece is there's not sometimes there's not a lot of time to give that education, but when you find different programs that are able to give you those courses, I think that's helps bridge
Yeah.
the gap between the technology education.
Absolutely. I agree.
I would say that another option is in some communities throughout the country, some of the community colleges offer free classes to seniors on digital inclusion. And then I also, you can refer to the National Institute of Health, and it
Mhm.
speaks about digital inclusion as a social determinant of health.
Got it. Thank you. So many notes. So I really appreciate everybody's comments and ideas. I think I'm going to work on including all of your comments and ideas into the PFA network response. But again, also just encourage you to submit your own response if you're comfortable. You don't have to respond to every single question in the RFI, just giving your opinion. And mostly that we really want patients and families to have voice in where we progress with digital health. So
Libby,
yes.
let me give you just one more thought because we're
Yep.
old school.
Okay.
Don't forget the churches and the places where people go to worship, because within this environment, the churches are coming back in and trying to help people. And this would be a good time to get them caught up on technology. And this
Um,
and the community centers are doing the same thing.
awesome. Great
just
reminder.
just so you know, at least in Indianapolis, churches and senior community centers are not just doing line dancing, they're teaching AI.
That's fantastic.
Did you send the link to the CMS where we
Yeah,
can
let me
provide the
grab that
information?
for you real quick.
Okay, I just dropped it into chat.
Oh, thank you.
Mhm.
Just trying to grab it real quick, but technology, I can't grab anything real quick. It just takes some time. Oh, Michelle, I didn't see your hand. Go ahead. You can have the last word.
I was piggybacking off of what she said about the churches being a place to receive information.
Mm-hmm.
I still wouldn't know where to find PFA.
Yeah,
So she said, so where do I find the help or, the
right,
conversation?
right. It's a good point. So maybe even just thinking in terms of the response, maybe even embedding peer foundations and organizations into how those get rolled out. Yeah, that makes perfect sense. Thanks, Michelle. And thanks to all of you. I really appreciate the conversation. You've all contributed so much to our thinking. And so, yeah, as always, I hope you all have a wonderful weekend and celebrate Father's Day in whichever way makes sense for you. And yeah, we'll talk to you again soon.
Thank you. Good meeting.
Bye. Thank you.
So
Bye.
long.
Thank you. Goodbye.
Thank you. Goodbye.